Well, let's dive into this, shall we? Ear, nose, and throat's a classic, especially for you nursing students and faculty out there.
Absolutely, and there's a lot more to it than meets the eye, or ear, I should say.
Exactly. We're going to go beyond the textbook basics.
Yeah, the stuff they don't always tell you.
Right, like those weird little details that make you go, huh, never thought about that.
That's what we're here for.
So picture this, the ear, not as this simple organ, but like a crazy, complex machine.
Yeah, a machine with tons of moving parts, all perfectly synchronized.
And when it all works together, we get the beauty of sound.
It's pretty remarkable when you think about it.
Okay, let's break down this machine, starting with the external ear. Seems simple, right?
You'd think so, but even the ear canal has some tricks up its sleeve.
Oh yeah, that S shape, right. Why is it so curvy?
Well, it helps funnel sound waves towards the eardrum. But that same shape...
Makes it super sensitive to pressure.
Exactly. That's why ear pain can be so intense sometimes.
That makes sense. Okay, moving on to the middle ear, where we find those awesomely named bones.
The malleus, incus, and stapes, the tiniest bones in the body.
They're like a microscopic relay team passing along the vibrations.
And that last one, the stapes. It's like a tiny piston concentrating all that energy onto the oval window.
It amplifies the sound.
Exactly. It needs that boost to transfer into the fluid-filled inner ear.
Okay, and then we hit the cochlea, that snail-shaped wonder.
Filled with fluid and thousands of hair cells that dance to the sound vibrations.
Wait, dance?
Well, they sway and move in response to the vibrations.
And that movement?
Triggers electrical signals that shoot up the auditory nerve to the brain.
Boom. Sound processed.
It's like magic, but it's science.
Okay, but what happens when this intricate machine breaks down? Enter hearing loss.
Right, and there are two main types, conductive and sensorineural.
Conductive, that's like a blockage, right?
Exactly. Something's preventing those sound waves from getting to the inner ear.
Like earwax or fluid in the middle ear.
Exactly. It's like a traffic jam on the sound highway.
Sensorineural, that's trickier, right?
It is. This one's about damage to the inner ear itself, the hair cells or the auditory nerve.
And this one makes understanding speech harder, especially in noisy places.
Right, because the inner ear can't filter out the background noise as well.
Like trying to listen to a radio with tons of static.
Exactly. You can hear something, but it's distorted and jumbled.
And here's something I learned that blew my mind. Medication can play a role in hearing loss.
Absolutely. Some medications can cause temporary or even permanent damage to those delicate hair cells.
Really? Which ones?
Some antibiotics, chemotherapy drugs, even aspirin and certain diuretics can be culprits.
Wow, I had no idea. It's definitely something to keep in mind, especially for our patients who might be on these meds.
Absolutely. It's all about being aware of the potential side effects.
Okay, let's move on to those everyday ear complaints that we see all the time in practice. Earaches, drainage, that annoying ringing in the ears. You know what I'm talking about.
And again, understanding the anatomy helps us make sense of it all.
So, like with ear pain, the location tells us a lot.
Right. Outer ear pain, like when you move the auricle or press the tragus.
Otitis externa, the classic outer ear infection.
Exactly. But deeper pain, maybe with fever or a sore throat, that points us more towards
Otitis media, the middle ear infection.
And it's important to remember those middle ear infections. They can sometimes lead to complications.
Like mastoiditis, which can be really serious.
Right. That's an infection of the mastoid bone behind the ear. Can even require surgery, so we got to take those earaches seriously.
Okay, and what about that ringing, that tinnitus? Ugh, it's the worst.
It can be incredibly frustrating for patients, and the causes can be all over the map.
So damaged hair cells, loud noises, those are the usual suspects.
Right. But it can also be a symptom of things like Ménière's disease, or even TMJ problems.
Wait, jaw problems?
Yep, that temporomandibular joint can throw all sorts of curveballs.
So it's not just about ears.
Exactly. That's why a thorough history and exam are crucial. We need to look at the whole picture.
It's like putting together a puzzle, right? Each piece gives us a clue.
Absolutely. And speaking of puzzles, let's tackle dizziness. Talk about a diagnostic challenge.
Right. Because dizzy could mean so many things.
Exactly. Lightheadedness, spinning, feeling unsteady.
So how do we even begin to figure out what's going on?
We ask specific questions, not just, are you dizzy, but what does dizzy feel like for you?
So we can distinguish between vertigo, presyncope, disequilibrium.
Exactly. And then we pair that with a targeted physical exam.
To figure out if it's something benign or something more serious.
Right. Because dizziness, it can be a sign of a lot of different things.
Okay, let's shift gears from the ear and head over to the nose.
It might seem simple, but it's way more than just a passageway for air.
Oh yeah, the nose does a ton of work.
It cleans the air, humidifies it, warms it up before it hits the lungs.
Like a little air processing plant.
Exact.
But to understand how it does all that, we got to break down the anatomy, starting with the nasal septum.
The wall that divides the nasal cavity in half, made of cartilage and bone.
And a lot of people have a deviated septum, right?
Yeah, it's surprisingly common, meaning it's bent to one side.
But is that always a problem?
Not necessarily. A slight deviation usually doesn't cause issues.
But a severe one can block airflow.
Right, and might require surgery to fix.
Okay, next up, turbinates. Those are.
Those bony structures covered in mucous membrane, they stick out into the nasal cavity.
What do they do?
They increase surface area, which helps with filtering, warming, and humidifying the air.
And they're involved in our sense of smell too, right?
Exactly. The nose is a multitasker.
Okay, can't forget about the sinuses, those air-filled cavities in the skull bones.
They're important for things like voice resonance, and they lighten the weight of our skull, too.
And we can actually learn about sinus health by palpating them, right?
Exactly. If someone's got sinusitis, those frontal and maxillary sinuses are going to be tender.
So we're putting together the pieces of the puzzle, just like with dizziness and earaches.
Absolutely. It's all about connecting the dots.
And the color of the nasal mucosa, that can tell us a lot too.
Oh, yeah. A healthy mucosa should be pink and moist.
But pale or bluish could mean allergies.
Right. And red, inflamed, that's more likely an infection.
Okay, so we've talked about ears and noses, but we gotta make time for those throats too.
We've got a whole deep dive section just for that. But first, let's take a quick break.
We'll be back in a flash to wrap up this ear, nose, and throat extravaganza. Welcome back to our ear, nose, and throat adventure. We've covered a lot of ground already, but now it's time to get hands-on, Let's talk assessment.
Yeah, this is where the knowledge really comes to life, right? It's all about applying what we know to actually help our patients.
Absolutely. So let's start with the ear exam. I remember when I was a new nurse, the otoscope was my nemesis.
I get it. It can be intimidating at first, but with practice, it becomes such a valuable tool.
Like a window into the middle ear, right?
Exactly. But before we even grab the otoscope, we start with good old-fashioned inspection. We're looking at the auricle, the outer ear, for any signs of trouble.
So like any deformities, lumps, skin lesions, that sort of thing.
Exactly. And don't forget to palpate. Gently pull on the auricle, press on the tragus, feel behind the ear over the mastoid process.
To pinpoint the source of pain, right? Help us differentiate between otitis externa and otitis media.
You got it. Now for the main event. Otoscopy.
Time to shine with that otoscope.
We're using it to visualize the ear canal and the eardrum.
Making sure to choose the right size speculum, of course.
Absolutely. We want the largest one that fits comfortably, no pain. And remember to straighten that ear canal before inserting the speculum.
Upward, backward, and slightly away from the head for adults, right?
You know it. It's all about being gentle and minimizing discomfort.
Once we get a clear view, what are we looking for on that eardrum?
Color, contour, that sort of thing. A healthy eardrum is usually curly gray and slightly concave.
And the cone of light, that's always a good sign.
Right. That triangular reflection tells us the middle ear is well ventilated. But if it's distorted or missing...
Could mean the eardrum's retracted or bolting, right?
Exactly. Could be a sign of pressure changes in the middle ear. So many clues packed into that little eardrum.
Okay, after we've checked out the ear, we got to assess hearing. The whisper voice test is a good screening tool. But what if someone fails? How do we figure out if it's conductive or sensorineural?
That's where our trusty tuning forks come in. The Weber and Rinne tests, they can help us distinguish between the two.
I remember those from nursing school. Sort of. Can you give us a quick refresher?
Absolutely. So the Weber test, we use it to figure out lateralization. Which ear hears the sound louder?
Okay, and how do we do that?
We strike the tuning fork and place it on top of the patient's head. If it's conductive hearing loss, the sound's louder in the affected ear.
Because of the blockage?
Exactly. The blockage actually amplifies the sound through bone conduction.
Makes sense. And the Rinne test?
We're comparing air conduction to bone conduction there. Strike the tuning fork, put it on the mastoid process, then move it next to the ear.
And normally, air conduction's louder, right?
Right. But in conductive hearing loss, bone conduction wins again, thanks to that blockage amplification.
It's amazing how much we can learn from these simple tuning fork tests. All right, let's move on to the nose exam. What are we looking for there?
Well, just like with the ear, we start with inspection. We're looking for asymmetry, deformities, tenderness.
And signs of inflammation or infection, right? Like redness, swelling, discharge.
Exactly. If the patient's complaining of pain, we'll gently palpate the nasal tip to check for tenderness.
And if we suspect a nasal obstruction, we can have the patient breathe in while we block one nostril at a time.
Yep.
Right?
Simple but effective way to check airflow.
And then we break out the otoscope again?
Double duty. This time we're using it to peek inside the nasal cavity.
Gotta love a versatile tool. What are we looking at in there?
We're checking out the nasal mucosa, the septum, and the turbinates.
Looking for the same things as with the external exam.
Pretty much. Color of the mucosa, any swelling, bleeding, discharge. We're also checking if the septum is deviated.
And we talked about how that color can be a clue, right? Pale or bluish could mean allergies, while red and inflamed might suggest infection.
Exactly. And don't forget about those turbinates. They can get swollen and congested, especially with allergies or infections.
It's amazing how much information we can gather from just looking around in there.
Right. And to wrap up the nose exam, we'll palpate the sinuses. Gentle pressure on the forehead and cheeks to check for tenderness.
Another sign of sinusitis, right? Okay, so we've tackled ears and noses. What's next on our ENT adventure?
Time to move on to the throat. We'll cover the throat exam and all sorts of health promotion strategies for the ear, nose, and throat.
Sounds good. Let's dive in. All right, on to the grand finale, the throat. But before we get into that, let's talk about how we can keep all these ENT systems healthy in the first place.
Prevention is key, right? We've got to empower our patients to take charge of their own health.
Absolutely. And when it comes to the ear, noise-induced hearing loss is a biggie.
Huge. It's so common. But the good news is it's mostly preventable.
So how do we spread the word? What can we tell our patients to do?
Earplugs, earplugs, earplugs. Concerts, sporting events, using power tools. Anytime there's loud noise, those earplugs need to be in.
Simple, but effective.
Exactly. And we also need to talk about safe listening levels with headphones.
Keep the volume down, take breaks. Those ears need a rest.
Right. And for those working in loud environments, hearing protection is a must.
Earplugs, earmuffs, the whole 9 yards.
And employers have a responsibility to provide that protection and educate their employees about the risks.
It's a team effort. Okay, let's move on to nasal hygiene. Not the most glamorous topic, but super important.
You're telling me that nose works hard to filter out all the junk in the air we breathe.
So keeping it clean is essential. What are your top tips?
Saline rinses are a game changer. Gentle, effective, and you can use them daily to flush out allergens, irritants, mucus, the works.
I swear by those during allergy season. They make a huge difference.
They really do. And of course, good old-fashioned hand washing. Can't forget about that.
The foundation of infection control.
Exactly. And while we're on the topic of prevention, let's talk about vaccinations.
Crucial for preventing illnesses that can have ENT complications.
Right, like the flu, which can lead to ear infections, or pneumococcal disease, which can cause sinusitis.
So staying up to date on those vaccines is super important, both for us and our patients.
Absolutely. We need to be advocates for vaccination and make sure our patients have the information they need to make informed decisions.
Okay, so we've talked about prevention, but what happens when those symptoms do pop up?
We need to encourage our patients to seek care early. Don't wait until things get really bad.
Early intervention can prevent complications and lead to better outcomes overall.
Absolutely. And we need to create an environment where patients feel comfortable speaking up.
Open communication is so important.
It's a partnership, right? We listen to our patients, answer their questions, and involve them in the decision-making process.
Well, I think we've covered just about everything ear, nose, and throat related, from anatomy to assessment, common conditions to prevention. Phew.
It's been quite a journey, but hopefully a fun and informative one for everyone listening.
We've definitely gone beyond the textbook basics.
Absolutely. And hopefully we've sparked some curiosity to keep learning and exploring this fascinating field.
Because there's always more to discover. Thanks for joining us on this deep dive into the world of the ear, nose, and throat.
And until next time, take care of those amazing sensory systems.